Hello, everyone. Looks like we are just getting started. It is we'll give everybody a minute to kind of log on. So before we start our presentation in our Bladder Chatter webinar. So any of those that are on, if you could maybe pop in the chat where everybody's from, we'd love to know where everybody is located. I'm here in Sioux Falls, South Dakota.
I'm in Richmond, Virginia.
Tulsa, Oklahoma. I've never been to Tulsa.
Oh, I haven't either.
Yeah. I've driven through Oklahoma.
I have not, even on my trip this year. Did not drive through Oklahoma. Let's see. So it's 8:30.
Joining, just another from Sioux Falls, South Dakota. Hello. So anybody else joining in, make sure to just let us know where you're from in the chat. And then we'll get started in about a minute or so. And again, welcome to Bladder Chatter. We're going to be talking about tips for pelvic health and bladder control for women over 40.
We're really excited about it. It's going to be a good bladder chatter.
A good little chat.
Yeah.
All right. Well, maybe we will get started and people can kind of jump in as we get going. And Buki is in Minnesota, known to some as Iowa.
Right on the border, I guess.
We're close together, right? Okay, so again, my name is Leah Folker. I am a doctor of physical therapy and a pelvic floor physical therapist. We'll each kind of introduce ourselves. I am, again, in South Dakota. This is where I went to my undergrad and graduate and got my doctorate in physical therapy. And I moved down to Arizona to start my practice. Worked for an amazing clinic down there. And that's where I grew my passion for pelvic floor physical therapy, because there was nobody in the area available to those women. So we had a couple children, and then we moved back home to South Dakota to be with family. And I joined the team of Pelvital earlier this year. So we were really excited to bring some educational materials to everybody.
All right. So my name is Shravya. Go ahead. Fun fact. We're going to do fun facts.
Fun facts. And if anybody wants to share a fun fact about you, you can pop that in the chat too, and it'll be fun. Fun fact. Oh yeah, I took my first yoga class this past weekend. I've never taken a true yoga class. I've only done it related to physical therapy. So I did it just at home, but it was still fun to learn their fun words.
That's the fun words.
Oh, yeah. That's awesome. The words.
My fun fact, I went on a 6-month adventure this year with my husband, and we went across the country and we visited 15 national parks. And I had never been camping before. Well, I've been camping one time, but we camped for 21 nights. It's a lot of camping.
And you were living mostly out of your car, right?
In my car, out of some Airbnbs, out of the tent. It was an experience, but a really great one. So that's my fun fact. Oh, and I should probably talk about myself too. So I'm Shravya Cavella. I am a doctor of physical therapy as well, also an orthopedic clinical specialist. I am from the Northern Virginia, DC area. Went to undergrad in Virginia and went down to Atlanta for my DPT. Went right into an orthopedic residency where I was opened up to the world of pelvic health through there, and became very passionate about it because of my own, some of my own personal medical history, and just learned that there's so many women out there like me who are dealing with pelvic health conditions. And so, like Leah, just wanted to join in providing education and increase in awareness anywhere that I could. So I joined Pelvital in March of this year and work more on the business development side. And Leah and I have had a great time working together to provide and create educational resources like Bladder Chatter and hopefully many more to come. So
I'm the customer care manager here. And like Shravya said, we are both here at Pelvital, which is a medical technology company focused on women's healthcare. So our true mission is really to educate women and to make them feel comfortable and confident in their decisions, and just being able to know and recognize that there are other alternatives out there to just living with it, dealing with it, and coping with bladder leakage too. So let's get started.
All right, so here we have listed just a couple things that we're going to cover today. Primarily, we're going to talk about what exactly the pelvic floor is and what to expect as we get older. So a lot of what we know about has to do with hormonal experiences we go through menopause, but we want to talk about how that's connected to the pelvic floor and how that might relate to some of the symptoms that we experience. We'll go from there and we'll talk about specifically simple tips and tricks that you can take away from today to help you keep your bladder healthy. Help with primarily stress urinary incontinence is what we'll talk about, but we'll get into a little bit of some other bladder health tips and tricks. And the biggest thing we really want you to participate in is please ask us questions. We love questions. This is something that Leah and I do every single day. We talk about this stuff every day. So no question is unacceptable or TMI, too much information. Please ask us questions. You can put them in the chat. And we have Buki and Carrie looking in the chat that will kind of take all those questions, compile them for us. So at the end of the presentation, we can make sure that we hit all of them. So a lot of women wonder, is what I have, is stress urinary incontinence, is it normal? Is it common? So the answer to that is yes, it is common, but it's not normal. And a lot of us might think, okay, well, it happens as we get older. I just change my clothes. I can just use pads. It's not a big deal. But that can get really frustrating. And we hear that a lot. I know, Leah, you've heard that from patients as well, where women will come in and just say like, gosh, I just have used pads and been dealing with this for years. Like we're talking 5, 10, 15, 20 years. And just getting tired of it. And the answer is that urinary incontinence is not a normal part of aging, even though all the pad companies like to have really beautiful different types of pads and marketing, and they can be useful. And it's okay to have this urinary incontinence, but we want you to know that it is not normal and it can be helped. There are things to do other than surgery. A lot of people think, gosh, is this something I'm going to need surgery for? The answer is no. There's a lot of conservative treatment options out there available that can truly help you, the things you can do even at home to get you started. And so we're going to get into
some people don't even
today.
seek care. They just buy these because they don't even know that there is help out there. They just think like this is the right option, their only option.
Yeah, absolutely. So are there other options? Yes, there are other options.
So let's get into a little bit about the pelvic floor and menopause. So the interesting thing about menopause is it's one of those what are called retroactive diagnoses. So you can't really say that you've gone through menopause until you've had 12 consecutive months without a period. So even if you've gotten to 11 months, you get a period, nope, you're still pre-menopause. You have to wait 12 more months before you can say you've gone through menopause. You are post-menopausal. So the average age of menopause is about 51, and most people experience symptoms possibly around 47, with a life expectancy that we have close to 81. So we have the opportunity to live half of our life either in menopause symptoms, or post-menopause. So we really want everyone to be educated in the symptoms that could happen and treatments to really help us. So this is a common diagnosis with menopause in the pelvic floor. The first one is GSM, the Genital Urinary Syndrome of Menopause, and it'll affect more than half of women that are postmenopausal. With a loss of estrogen comes vaginal dryness. It'll be itchy, thin skin. Because of that thin skin, itchiness, dryness, that can lead to painful intercourse. That loss of estrogen leads to a change in the elasticity in our tissues, which will cause not only vaginal changes, but changes in the bladder. So that'll lead to your urinary urgency, frequency, and then at an increased risk for your urinary tract infections. And then with that change in the bladder, because it's not as mobile anymore, we can get urinary incontinence. So whether that's stress, meaning leakage with coughing, laughing, sneezing, jumping, bending, any activity-related incontinence, not necessarily. Some people ask me if it's mental stress-related incontinence, and it's physical stress-related incontinence. Fair question. Yeah.
It's a fair question.
It can get confusing.
Yeah.
Urge incontinence too. Well, we'll also mostly talk about stress incontinence during this webinar today. Urgency incontinence is the leakage with not being able to make it in time. Kind of that, oh, gotta go right now, and then leak before you get to the bathroom. And then mixed will be a combination of both. Nocturia, now that's when we get up at night to go to the bathroom. And it's defined really as more than once per night. So if you're getting up a lot of times in the night, then you would have some nocturia symptoms. And then bladder training is going to be important. Pelvic organ prolapse. That one is really interesting because you can really get that with a change in tissue tone, tissue tension. The muscles of the pelvic floor lose their elasticity. And so the organs kind of come with it. Or it can be the opposite and you get really a lot of tension down there, and then the pressure management isn't normal and organs will start to descend too. So that's where women will complain of that pressure, dull, heavy sensation within the vagina. And now the last one, Shravya and I love as physical therapists. The first four are more of medical diagnoses. The last one is more of our physical therapy diagnosis when we treat people. That's what we evaluate. We evaluate strength, function, flexibility, range of motion. So that pelvic weakness can come as we age. It can come during pregnancy. It can come from childbirth, multiple births, birth trauma, and weight fluctuation too, all kind of play a role into the changes that are happening down there. Now let's get into the anatomy a little bit more. So I love this picture. It's a side view. So here's a picture of the pelvis from the front, and then here's the pelvic floor from the bottom. So in this picture, it's taking the pelvic anatomy and just cutting it off right through the center. So in the pelvic bowl here, we can see the rectum in the back, the uterus in the middle, and then the bladder in the front. And then in the picture here, same alignment from pubic bone to the lower back to the tip of the tailbone. And then the muscles that run through them. So in the first one, that's a nice, normal, toned, happy pelvic floor. Everything is in the bowl where it belongs. And then the picture on the right, that would be our pelvic floor muscle weakness. So imagine this image here, and if this muscle has dropped and descended downwards, the contents are going to tend to follow what was supporting it. So that can lead to some prolapse symptoms too, because now your bladder, the uterus, if you still have one, and the rectum have changed positions. And I think what Shravya and I also love about this picture is when you look at the bladder, the urethra that goes down on the left is nice and tight and toned, but on the right, it's kind of weak and lax and has lost some of its capabilities.
And Leah, I just want to pop in and reinforce exactly what you said on the previous slide, which is it's not just one thing or one factor that can cause pelvic floor muscle weakness. Yes, aging can be a role, but there could be tearing during childbirth. Even our abdominal muscles getting weak can impact how our pelvic floor functions. There's just a lot of different things that go into it. And so we're thinking kind of more cumulative and just over time, things that occur that might cause our pelvic floor muscles to weaken.
Here's another picture of what happens specifically related to the bladder. So the one on the left, again, is a nice full bladder. And then that sphincter and those supporting tissues are closed. So no urine is leaking out. And then compared to the right, when that urethra is kind of weakened and lost its tone, leads to an increased risk of that leakage. Same with those muscles that would weaken too.
So, what does happen as we get older? So, most of us know that our estrogen levels, hormonally, our estrogen levels will peak and then decline. Primarily, you can see in this picture between the ages of 40, let's say 40 to 60, although everyone is different, we'll have the steepest decline in our estrogen. So, completely normal, this happens. But with that hormonal change, just like anything else, it's going to impact us and our muscles and our skin. So some of the things that we can expect are thinning and dryness of the vaginal wall, a loss of elasticity of the tissue. So the way I think about that is imagine you as a kid, or imagine like a little child who's got plump cheeks. You know, we think cheeks, they've got like really nice plump cheeks when they smile. But then as we get older, generally our cheeks might sag a little bit. Our skin might become a little bit thin or papery, a little bit easier to tear. And that's just natural. That's what occurs as we get older. And that actually happens even with vaginal tissue. So that plumpness of our vaginal tissue is going to decline. And that can lead to some irritation, some itchiness, like Leah mentioned. It can cause some discomfort, such as pain with penetration, because that tissue doesn't have the elasticity that it needs to be able to elongate and return to its original function. So this is going to happen. It's natural. That being said, it doesn't mean that we're doomed. I like to make that clear. We're not doomed. It's very natural that this happens, but there are other factors, as we know, that impact our pelvic floor. And the pelvic floor doesn't work alone. So there are definitely things that we can do to help support our pelvic floor and make sure that we can still function with a positive, great quality of life without having to deal with these symptoms that might exacerbate as our estrogen levels decline. And so we can talk about
just like lubrication can help ease that discomfort with penetration. And there's a lot of like hormonal. Yeah, exactly.
Yeah. So do you need to just live with it?
Heck no. Definitely not. So we want to take just a quick second. We're going to pop a poll up on the right side of your screen, or if you're on mobile, it'll just pop up really quick. We want to know what type of urinary incontinence that you guys might be experiencing. Are you having SUI? Are you having urgency, overactive bladder, combination, or maybe not really sure? Your answers will be anonymous. Once you respond to the poll, then it'll pop up so you just see a percentage of other people that might be also experiencing that, or we can kind of see what other people are having too. So a little bit of some overactive bladder, some mixed issues, some SUI, kind of all over the board.
Yeah, and totally common. You know, I know, Leah, you have also seen patients that come in with multiple of these, and that's because we know that these muscles never just do one thing, they do it all.
If only somebody had only one thing going on, not really the case.
I know, if only.
Exactly.
But we're all
usually never one thing. So what can you guys do for the SUI mixed OAB symptoms? Talk to your healthcare provider. You know, us as medical providers we're trained for these things. Your healthcare provider is equipped to do different tests to really determine maybe what the best treatment plan is for you. Is it pelvic floor physical therapy? Do you need more tests? What's going to be the best for you? So just kind of giving it out there and talking about it to somebody is going to be a really good option and kind of a first step to being able to help whatever symptoms you have going on. And then the second one is really what Shravya and I love to do too, is educate people. You know, just learning simple things at home. Those of you that have joined today to watch this webinar, you're wanting to educate yourself and learn about some things that you can do at home, some other treatment options out there. Maybe you've seen A, B, C, D doctor that just tell you to deal with it. You're getting older, deal with it. You've had how many kids? Like, expect it. You don't have to just deal with it or expect it. Try something first and see what works for you. Yeah. Or We'll pop up another quick poll too.
Yeah.
This is just a quick, easy yes or no, that if you guys have tried any treatments. So if you have, just yes. If not, no. For those of you that have, just if you feel comfortable, you can let us know in the chat, and we can kind of look at that too to see if anybody's done anything. So it looks mixed 50-50 right now. Half of you have and half of you haven't. So being educated is good. Seeing other treatment options out there or somewhere to start.
Yeah, and I always like to say that if you are seeing a healthcare provider and you're not feeling heard, like Leah said, see another one. You're not cheating on your healthcare provider. Most doctors want you to get a second opinion. I think the best ones do, because they want what's best for you. And if they're confident in the treatment they're giving you, they're going to be totally fine with you seeking another one to make an informed decision. So you know your body best. So make sure that you feel heard and like you're really getting the treatment that you need. Just find the right team for you.
Everybody. That's okay. Just fine.
Which is okay.
Okay, so now we're going to talk about some conservative or medical treatment options. And really here, you don't have to memorize this chart. Buki is going to pop in a downloadable handout for you guys to reference, so you don't have to look at this. We really want the take-home message to be knowing that there are other options out there. For those of you that have said you have done treatment options, maybe they didn't work. Know that there are other options out there. There are a lot of different conservative treatment options or at-home treatment options for all these different types of urinary incontinence. And there's different medical treatment options too. Sometimes it's not just one that can help us, but more than one, different one, combination at the same time can be really powerful too. And you are not alone. That's one thing we really want everybody to know. Stress urinary incontinence is probably the most prevalent form of urinary incontinence, affecting more than 16 million women in the United States alone. And if you are over the age of 45, the likeliness of having it is 1 out of 3. So if you and 2 of your friends are together, you or one of them probably has SUI. And over the age of 65, 1 in 2. So if you are with one of your other 65-year-old friends are together, you or your friend are likely to have stress urinary incontinence. So the fact of the matter is, we might want it to go away on its own, but if left untreated, the likeliness is these things tend to not go away on their own and tends to get worse as we get older. So some tips to help stress urinary incontinence. We fight for it, right, Shravya?
Yeah, I love that little bladder, right? He's got a little sword. All right, so 3 tips that Leah and I, if we had to kind of say in a nutshell, what we want you to take away of what you can start doing today from this webinar. Tip number 1 of those is going to be squeeze before you sneeze. You've got a nice little rhyme in there to help you remember it. And what that is saying is essentially before you feel a sneeze or a cough or a laugh, whatever occurs that might cause you to have some urine leakage, to squeeze your pelvic floor, that kind of 1 instant, that 1 second before you sneeze or before you cough, just to help give some support to your bladder and urethra, which is that tunnel that's going from your bladder out towards the entrance. So that can help. If you think back to that picture that Leah showed earlier and you saw those pelvic floor muscles kind of dipping down. Exactly. So she's got the model there. Imagine when you're sneezing or coughing, like think about the most violent sneeze you've had and how it might have just like shaken your whole body. I don't know if that's just me, but that happens, right? And when that happens, all of that pressure and force has to go somewhere. Generally, it's going to go down. Exactly. Which is why we'll talk about how other things also support your pelvic floor, like your abdominal muscles help your pelvic floor. How you breathe impacts your pelvic floor. But all of that pressure is going to go somewhere, especially if those other muscles aren't doing their job. And that can contribute to some urine leaking. So this can be used as an exercise. Sometimes we'll give our patients this is an exercise for home. We'll say, okay, you're going to sit in a chair. You're going to feel your pelvic floor squeeze and lift up away from the chair. Hold it, cough, and then let go afterwards, which is just as important to make sure you let go of your pelvic floor. Because imagine if I just walked around with my bicep like this all day. I'm going to get really tired and kind of weak. I have nowhere else to go. So we want to make sure when we squeeze, we're going to let go as well. So that's your tip number 1.
I think that's one of my favorite tips too. I've seen women where they have been, this is what has cured them too. Just this simple little phrase. But not everybody's that easy.
Yeah. Right.
What a good tip.
What a good tip to take away. Tip number 2, exhale on exertion. So we really like the alliteration. We like the rhymes. Exhale on exertion. I know, right? So if you think about that pressure system or where that force is going. So Leah, if you could hold up your model,
have a wonderful balloon that I love.
Oh, you got the balloon. Okay. So if you look at Leah's balloon, you see that the diaphragm is at the top and we've got the pelvic floor at the bottom. So how we breathe, the diaphragm is a muscle that helps us breathe with our belly. So a lot of us we breathe here if we're feeling anxious or stressed or we're not paying attention to how we're breathing. But we should actually be breathing with a combination of our belly and our chest. So when we breathe with our diaphragm properly, that actually moves well with our pelvic
Like if we
floor.
have it, then it'll move equally.
But, yeah. Yes. So there's a pelvic floor at the bottom. And if you kind of think of that balloon, it's sitting right in that section of the pelvis.
You're welcome.
Such a good Vanna White. And so you have that diaphragm and you have the pelvic floor. And so let's say you hold your breath or you're not properly breathing. All of that pressure is going to go somewhere. So just going to squeeze the balloon and you can see that pressure is going downwards. So this can contribute to symptoms of prolapse, that kind of feeling of bulging or pressure downwards, sometimes during certain activities, such as walking, running, lifting, or just every day. And similarly with urine leaking. If we're putting pressure on those muscles, pressure on those organs that aren't being supported, then
with your abs.
Yes, exactly. That's a great depiction of that. So having your abdominals functioning properly is just as important. And they all work together. So that's a lot of information. So let's break it down real quick. The thing you're going to take away from that is you want to exhale. Anytime you're working yourself, anytime you feel like you're exerting yourself. So if you're Leah and you're picking up your 3-year-old kid, you're going to exhale as you pick him up. A lot of people will do this. And then pick him up and hold like that. Exactly. And that pressure has to go somewhere. So if there's an activity where you are leaking, like you're lifting something or you're walking or you're running or you're feeling pressure during those activities, see if you can exhale throughout that entire movement instead of holding your breath. And that's a good starting place to get your diaphragm and your pelvic floor to function together.
Just like this picture, this would be her starting point. So she would go and then at her hard part.
Yes.
And reduces injury all around to the whole body too. I think this is good too. With the spine muscle that'd be in the back. Yeah. So
hernias.
Too much pressure in one spot would injure one of the other links in the chain.
Mm-hmm. All right, tip number 3. So this is kind of the meat of our presentation. Tip number 3 is check your landing. So what we said with tip number 1 and 2 kind of build up to this tip, talking about how force and pressure impacts our pelvic floor. So if we're walking or we're running a certain way, that can also impact our pelvic floor. So a lot of times people think, oh, I can injure my knee or my hip if I jump incorrectly, or if I land while I'm running or walking incorrectly, or something like that occurs over time. That same impact and force can create change and pressure issues with our pelvic floor. And so if you look at this picture on the slide, we have the woman here. You can see her pelvis is kind of dipped compared to the lady in the back who has a nice level pelvis. You can see her knee is kind of coming inwards, and her foot is dropping inwards. So that's all a really fancy way to say that all of that force that is coming through her foot up into her knee, her hip, her pelvis, her back, it's not being evenly distributed. It's all kind of going in wonky places. And now each of those joints, all of those muscles are meant to function for you and help you stay strong during these activities, but they're not meant to do their job plus everybody else's. And in this situation, they're having to really kind of work in ways that they're not actually supposed to give you the stability and support necessary. But at some point, that might break down. That pressure or force is going to impact the pelvic floor and the pelvis. And we know with that balloon that Leah just showed you, all of that force is going to go somewhere, and that can impact your pelvic floor and lead to urine leaking. So check your landing when you're walking, when you're running. See if you can land softly. Kind of, I always tell people, like, listen as you walk or you run. And if you're like a music person, think about a nice rhythm. You want it to be nice and equal, and see if you can try and use your muscles more. So instead of landing heavily, you're walking with a lighter step, meaning your muscles are kind of controlling how your feet are landing. This is a great place if you are someone who is a runner, or you're like to exercise a certain way, or even just with everyday activities, you have a busy heavy lifting job, or just a busy day in general where you're having leaking. This is a great place to see a pelvic floor physical therapist, because they can help you figure out what aspects of your form may not be what it should be and how it might be impacting your pelvic floor. But just starting to think about how that might be. So those are our 3 tips. And I want you guys to know that even if you're doing all 3 of these tips and you're like, I'm doing these regularly, I feel like I'm missing something, please don't get discouraged, because we know that these 3 tips are very, very helpful, but they're not everything. Every single person presents differently, and every single person performs things differently. So if you're comparing Leah and myself, I might be doing a Kegel or a pelvic floor contraction, and Leah might be doing one. But who's to say that we're doing it correctly? We can't see right now. You guys can't see down there. So we just don't really know whether we're doing it properly, if we have muscle tightness, if we're weak, but we're holding our breath, or what else is going on. So if you're incorporating these tips, and you take these away today, and you want some additional guidance, that's where I would seek out a healthcare provider to help guide you.
Yeah, and I'll just add in there too, like with the image here on this slide, I've seen lots of women with this wonky little pelvis, and Shravya has too. I'll give them orthotics, kind of correct it from the ground up, and you'll be surprised at how much better that positions their foot, helps to rotate their knee in a better position, levels out their pelvis, and then that's corrected some of the ground forces. And then you can get at that pelvis and get those hips a lot stronger too, because that's shown to be so important as an aspect of pelvic floor strengthening with incontinence. Yes, hip strength, very good.
All right, so now to talk about a new mechanotherapy product that helps with stress.
Anybody is curious if they do or do not, what kind of like urinary incontinence you have, Buki will put in the chat a quick little like link to our website to look to. Is it SUI? It's just 6 quick questions. And you can take that to see, just based on your symptoms, what you might be having too.
Thank you, Leah. Yeah, that's a great quick questionnaire. Super easy to take. Very informative. Awesome. All right. So to talk about flight really quickly, this is a treatment to consider for stress urinary incontinence. Specifically helps with pelvic floor strengthening. So if pelvic floor strengthening is what you need to help you with your urine leakage, and if you're appropriate for that, so you don't have any pain with penetration or anything like that, then flight might be a good option for you. It uses a technology called mechanotherapy, which helps impact your Kegel contraction. It makes it even more effective. So if you want to learn a little bit more about mechanotherapy and flight itself, we're going to put in a little pop-up. So Buki will do that in a minute, about what mechanotherapy is. It'll take you to our website. You can browse around there, and yeah, it'll have a lot of great information there for you if you are interested.
And the excellent thing too is they found that flight really helps to make your Kegel contraction 39 times better than each one on its own. So it kind of gives that big amplification factor to each one that you do. That's a nice, easy option if you haven't done anything. Now on to some healthy bladder tips for everyone.
I love this bladder. I just love the bladder cartoons. Right? They're just so cute. All right, healthy bladder habits to take away. So far, Leah and I have covered the anatomy of the pelvis, how the pelvic floor doesn't work alone, some tips you can take away for stress urinary incontinence. But we just wanted to include a little bit about some bladder health, how you can keep your bladder healthy throughout the day, just with everyday activities. So we summarized it here. The first one is just going every about 3 to 4 hours, which leads to about 5 to 8 times a day. I've had patients ask me, does that include night? It does not. Please sleep throughout the night, just your waking hours. So 3 to 4 hours, 5 to 8 times a day. And we go for the 8 to 10 Mississippi. So that's about 16 to 20 seconds, which is ideal. And every second is equivalent to about 1 ounce. So essentially that's what it should be, to be emptying our bladder to the capacity that we should be emptying it. So 16 to 20 seconds while you are peeing, that's the time.
Yeah, the 8 to 10 is about kind of a little over halfway.
Yeah. Another thing to take away, sitting fully on the toilet. So we've talked a lot about pelvic floor strengthening, but a big takeaway also from today is that just as important as it is to have a strong pelvic floor, it's just as important to be able to relax your pelvic floor. One of the reasons that is because that helps us have a proper urine stream. So if we're hovering over the toilet, our abdominals are engaged and clenched, our glutes are clenched, maybe your pelvic floor isn't able to fully relax, that might lead to issues with being able to empty our bladder fully. If you're not emptying your bladder fully, then you might have more incidences of leakage or urinary frequency, urgency, things like that sooner during the day than you would otherwise. So if you can, sit fully on the toilet to help relax your pelvic floor. And that also, I mean, a lot of times we think straining, we think of constipation, which is also very related. This is kind of a bladder talk, but know that we need to be able to relax our pelvic floor to have a proper bowel movement. And so straining is something we want to avoid. And that's where you'll find people will hold their breath and really strain down. If you think back to that balloon, all that pressure is going to go somewhere. And we really want your pelvic floor to be able to just relax and let everything go so that your bowel movements and your peeing habits, your urine habits can be totally normal. Other things to know, no just in case peeing. So what that means is that if you have to go to the bathroom, just check in with yourself and say, do I really have to go? Is my bladder telling me that I have to go, or is it more up here? So we know that our brain plays a role with how our bladder will function. If you've ever, we'll talk about that more, but that will play a big role. So if you're ever, saying, I just in case I'm just going to go before I do this, see if you can avoid that, because that will retrain and teach your bladder to do something that maybe it shouldn't really be doing. Last things to really take away is water. Drink water. So a lot of times if we're leaking urine,
so like half of our body weight in water. Yeah.
Yeah. Oh, completely. It's so much of our body weight, and we need to be drinking water because it helps us function better throughout the day. But it makes sense that if you're leaking urine, you are like, why would I drink water? I'm just going to leak more. But start paying attention to what it is that you're drinking. So there are actually bladder irritants, such as, I say the 4 C's, cocktails, unfortunately, caffeine, also unfortunately, citrus, and carbonation are kind of the 4 main ones. Everyone is different, but those are 4 ones that will often bother people. So something to think about if you do have a cocktail, for example, one night, see if you can drink a full glass of water afterwards. What that will do is it'll help keep your urine from getting concentrated. And if your urine is getting concentrated, it can then irritate the lining of your bladder and lead to more bladder accidents. And that's the opposite of what we want. So drinking water is your friend. Drink your water.
Just like Shravya said, there is a brain, bladder, and pelvic floor connection together. So this is a nice little chart that depicts how that really happens. So really the bladder only has 3 jobs. It fills, it stores, and it empties. And if there's a problem somewhere along the way, that can lead to dysfunctional voiding, overactive bladder, urgency, incontinence. So the first one is when the bladder fills. So then the bladder is relaxed and that pelvic floor has some natural tone and tension. And when it gets to the end of the cycle and that bladder contracts, then that pelvic floor has to relax to allow urine through. And if we're not letting that bladder fully kind of expand and learn how much it can grow, we can start to develop a disconnect. So in that first one, that first sensation to empty, when that bladder is starting to fill, so say we've had an accident before, we've leaked, we tell our brain that we don't want that to happen again. So we will get that sensation and we're just going to go to the bathroom. We're like, oh, a little bit, got to pee, a little bit, got to pee. And then that small urge then has turned into a large urge that we have created. So that's where we'll start to get a lot of those overactive bladder and urgency symptoms. So if that you're getting that strong urge to urinate when it's even just a little bit, so what's happening is then that bladder is starting to contract. And that naturally sends a signal to the pelvic floor that it's time to relax so that the bladder can empty through the urethra. And if we are maybe not strong within the urethra, the sphincter, and the pelvic floor, if this is continuing to contract and this is really weak, and we're like trying to shuffle to the bathroom at the same time, and this isn't strong enough to combat that, that's when we're going to have an incontinent episode too. So important that we learn how to gain control of our bladder so our bladder doesn't gain control of us. Sometimes it's a lot of, what's the word I'm looking for? Behavior that we have to change. We have to just retrain our brain of what a normal full bladder is again, if we've had a problem in the past. And it can happen. I've seen women that have improved and men, even for at nighttime and during the day, people that you can fix this even in just a couple days with some overactive bladder. I've seen people that have peed like 4 times at night and we do some behavioral techniques and some people have improved in as easy as 3 days. So there's definitely opportunity. You've seen it too, Shravya. And I mean, sometimes it's not easy to put in like all of the work that might go into bladder training. But the end goal is really what we're after. Sometimes it takes a little bit of work. Ooh, little tip. Don't ever squeeze your pelvic floor while you are urinating, because then if that bladder is trying to contract and you're going to the bathroom and it's telling the pelvic floor to relax, if you're squeezing here, it's telling this to relax. And it's really doing a disconnect. So if you learned something else today, don't squeeze while you pee. Yes.
And it causes UTIs. Urinary tract infections, which we don't want. So practice your Kegels off the toilet.
All right, here's our last little tips for today. Let's go over some quick hits on some urgency. So urgency will come, peak, and drop. So we've all had that, like, oh, our strong urge to go to the bathroom, we get distracted, and it goes away and you go on with your day. But if we have overactive bladder and urgency, that peak might feel really high and it might feel like it's never going to come down. So we really need to do some urge suppression techniques. And Buki will pop a handout in over in the chat that you guys can download with some great tips for OAB and urge, along with the tips that we already went through on SUI. So really it's going to learn to gain control over those peaks to help it subside. because the best time to empty your bladder is on a calm period to reduce that risk of leaking. Like I said, when that bladder is contracting, that pelvic floor is being told it's to relax, and if you're trying to shuffle to the bathroom and the pelvic floor isn't strong enough. Continence is truly a learned behavior. We learn it when we're children. Sometimes we got to relearn it when we're older. So that is all. So some of the key takeaways to know is hormonal changes are natural as we get older. Those hormonal changes and our history itself, what's happened to us. Shravi and I have seen all ends of the spectrum. Simple patients, complex patients, they all contribute to what's happening. And there are some easy at-home tips that Shravi and I have shared with you today that you can try, or other options to know that there are available to you. Know that there is that brain, bladder, pelvic floor connection. The pelvic floor does not work alone. And as Shravya said at the beginning of our webinar, you can still maintain great pelvic health over the age of 40. All right. Should we get to some questions now? Right.
Yeah, let's do it.
Let's see here.
Do you want to read? Do you want to start at the top, Leah?
Okay, so we have a question at 57. I have been recently diagnosed with a uterine prolapse, a grade 2. Wondering if this can be reversed with strengthening the pelvic floor muscles. Great question. Shravya, do you want to take it or do you want me to? Okay.
I can take it. Yeah. So with a grade 2 prolapse, we know that pelvic floor physical therapy can be very, very successful. We've said before, everyone is different. So there are different reasons why there might be a uterine prolapse. Without knowing your full history, don't want to make any assumptions. But generally, if pelvic floor weakness is the cause of your prolapse, which often it can be, then strengthening your pelvic floor muscles can really help with that. If you are incorporating a pelvic floor strengthening program at home and you're not seeing improvement, so by that I mean if you're doing, X number of Kegels per day and you've been working on that for a while, that's when I would see if you could see a pelvic floor PT to help you with that, to make sure that, like Leah had said before, that you are strengthening properly, that you are squeezing your pelvic floor properly. Maybe it's that your pelvic floor actually is at the proper strength, but maybe your breathing is off or your abdominal muscles aren't functioning as they could. But the answer to that is, I know that I've seen a lot of grade 2 uterine prolapses. Leah, I think you have as well. And we've had a lot of success with them. They can take time. Oftentimes prolapses are not solely about the pelvic floor. It kind of will impact, if you think about the balloon, all the other components. Exactly. So when you're squeezing, that pressure goes downwards and can cause the uterus to descend. Exactly. So they all play a role into each other. So the answer to that question, the simple answer is yes, it can improve. Your symptoms can improve with uterine prolapse. That being said, we know that pelvic floor physical therapy is very successful helping with grade 2 prolapse symptoms. However, in terms of reversing the tissue itself, we don't always see that reverse, though we generally do see the symptoms improve significantly.
I guess I would add, once you feel it's better, you would want to do maintenance things and learning how to reduce it from getting worse. And like Shravya said, pressure management, like with the balloon model too, it's all about how we put things together and use our body as a whole. I think is the best option. And there's some research out there that one of my favorite studies was in 2010 about, I can't pronounce his name well, Brecken. And they show that pelvic floor muscle training did help quite a bit of women with grade 1, 2, and 3 prolapse really feel a symptom improvement. And even see some grade level improvements, mostly in 3s and some of them in 2s too. So there is the possibility of improvements.
Absolutely. And the other last thing I'll throw in there too is you might have heard of a pessary helping with prolapse. So pessary is just a device that is inserted into the vagina to help give those muscles a little bit of support to keep the uterus or bladder, whatever it is, from descending. I will say that it doesn't have to be one or the other. Sometimes having a pessary and working on these pressure management things that Leah's talking about can work really well together, so that the pressure isn't going down into the pelvic floor while you're working on these things, so that eventually you can wean off of that pessary without having a worsening going on. So that might help with your symptoms and make you feel better earlier on as well. So kind of going back to what we talked about, that sometimes it's not just one thing. It can be a combination of treatments or approaches that can work really well. I know I've worked with plenty of nurse practitioners, physicians who fit pessaries, other PTs who do. So that's always, something to bring up with your provider.
Okay, let's go to our next question. As professionals, how do you feel about using yoni eggs? I will say I've never heard of a yoni egg before. Have you, Shravan?
I don't think I have either.
Is that
those,
like jade
weights?
eggs and stuff too? Is that what that is?
This can be simply, let's see, we'll just do a quick Google search here.
Oh, so it is some vaginal weights. Yeah, eggs. Vaginal weights are great too for pelvic floor muscle strengthening. I'll say that it has to be used correctly. Positioning is important. The weight is important. I mean, I've seen women that have come in with all sorts of different types of vaginal weights, and it just pops out, and they can't keep it in, even in a laying down, elevated position. And it's usually because sometimes they're not doing their pelvic floor exercise correctly. Maybe their tissue has been really stretched out. But yeah, pelvic floor strengthening with all these different types of devices. The thing I love about them is it gives you something to squeeze against. So it gives you that tactile cueing sometimes of where that is, and know that if things are pushing out or falling out, it needs to be evaluated. Are you doing it right? Is it the right treatment for you? Or maybe like tight underwear or tight outerwear to help kind of keep things where they need to go.
Leah, I just looked it up a little bit more. It looks like they are helpful. They're intended to use kind of an energy, help with healing, that type of thing, using kind of that approach. I will be honest, as a healthcare professional, I haven't really heard of them. I don't know if from a biomechanical standpoint, meaning thinking about the muscles and the support, if that's necessarily going to be beneficial or helpful. It wouldn't be my first choice. But I always tell people that if it helps you, it brings you relief, and it's not harming you, go for it, as long as you are addressing these other things as well, because we want you to feel better, not just temporarily, but long term. So addressing all of the things that we talked about. Personally, I don't think I have a big opinion.
I don't either. I'm not educated in it.
Yeah.
Okay, let's see here. Let's go to our next question. Should postmenopausal women take hormone replacement to help with symptoms? I will go from the standpoint of Shravi and I are physical therapists, so that's truly kind of out of our scope of practice to recommend medication to people. So that will come down to a discussion with you and your provider.
And I will add to that, hormone replacement can help if it's appropriate with you based on your conversation with your provider. But we know that sometimes these symptoms that we have can be about more than just our hormone changes. As we've talked about, there could be other things in our history that have contributed to pelvic floor weakness or tightness or just that control. So I'm going to challenge you all to think about not only addressing just the menopausal hormonal aspect, but thinking about the full picture, because we're full people, and we want to make sure that we're addressing every aspect of our health, so that you can really, really have a long-term benefit from the treatments you are seeking.
Okay, we have another question. Let's see. I canceled my appointment for the bulking agent because I was concerned about the chemicals they use. So I don't know much about them. So you'd be referring to the bulking agent for the urethra for stress urinary incontinence. So maybe if you're concerned about that, seeking some of the conservative treatment options, maybe pelvic floor physical therapy would be great for you. You can talk to us more about flight. That's truly kind of the perfect candidate for somebody for our device too. It's been proven to be so beneficial for women with stress urinary incontinence. There's so much like clinical research behind it on how beneficial it was. So Jeanette, just talk to us afterwards. You can send me an email, support@flighttherapy.com. It's on our website too. And you can go to the Ask a PT section, schedule a chat with me, and we can talk more about kind of maybe if flight is right for you, or you can look at the handout for maybe some other treatment options too. Anything you want to add, Shravya? Okay.
No, I think that's perfect.
Let's see, any other questions, other comments? You also said you have a pessary, but have developed a chronic infection since using it. So I guess I'd be curious even about the quality of your tissue too, and making sure that that's healthy, and so you have to make sure the infection goes away too. So I would talk to your doctor.
Yeah. And cleaning those can be a little tricky. Sometimes certain ones need to see a provider to clean them, and definitely questions to follow up with your doctor. But
pessaries sometimes have to be replaced about once a month. Okay, we see here. I jump rope, usually feel a leak and immediately pee. Then I'm set to go longer for periods of time. I know I saw, I did some talks with some CrossFit places in the past, and they were told like, oh, it's normal, or double unders. They'd be piles of pee, and they're like, just keep going, it's fine, because they're all doing it. I'm in the back like, what is going on here? So you're probably getting that leak because you may have not fully emptied your bladder beforehand, and some tissues are weak. Again, I challenge you, SK, to look at some conservative treatment options, pressure management that Shravya and I have talked about too. There's probably a lot of excellent options out there because stress incontinence and exercise can be helped.
Mm-hmm. And I'll take you back to our little picture of the woman running, and you saw the pelvis dipping. So it kind of makes me wonder, and I know we can all work on our form and certain things, but that might be a contributing factor. Even if you're doing it with perfect form, what's going on with your hip strength, your abdominal strength? If you think of that balloon, the abs are the front part. So having that proper strength and control can really help take that pressure off of your pelvic floor and maybe reduce that need for that leak that occurs right off the bat, and especially if you're not emptying your bladder. So
yes,
can be very interrelated.
All right. Any other questions, everybody? We will put in like in the chat, maybe a quick little pop into our Ask a PT section. You can ask some private questions to us. You can schedule a 10-minute chat with me. We can talk about your particular question. Buki will put in a little a link to it. So come visit our website. Let us know if you have any questions. And thank you so much for being part of our first webinar, Bladder Chatter. Yeah, more to come.
More to come.
Bye, everyone.
Bye. Have a good night.